Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Firstly, happy Janmashtami to all of you. And Janmashtami is here. Our favorite time of the year is also just coming in. Festival season is just kicking in. And with more and more people getting under the vaccine cover, many are now wondering till how long will we continue to stay indoors. It's time to go out. There is COVID fatigue. Then on top of that, there is work from home and kids at home. And a lot of stuff happening, so everybody needs a let out now. But along with this festival season, is it time for you to reconsider your COVID protocols and COVID guidelines as well? Why is it that scientists and experts, despite more and more people getting under the vaccine cover, are saying do not indulge out just yet, do not get into specifically big congregations? Why is it that Dahi Handi has been asked to not be undertaken this year around? Other festivals down south also undergoing the same protocol. Why? Well, short answer to that is new variants. And today on FYI, we'll be talking about some of those new variants that are becoming a cause of concern increasingly. For example, why is it that more and more US citizens are back in the hospitals? The same thing is happening in Israel, for example, and several other parts of the world. In fact, if you look within the country, Kerala, a prime example of more and more breakthrough cases coming in. But what exactly are breakthrough cases? Why is that happening? And how should you be thinking forward in this upcoming festival season is what we'll tell you. First up on the explainer, we'll talk about the first sublineage of the Delta variant that is now becoming a cause of concern. We'll tell you about AY.12. This is said to be a sublineage of the Delta variant, but why should you be bothered? Because this sublineage of the Delta variant, known as AY.12, has been detected in a number of states in India and is most likely the cause of the latest COVID surge as well, not just in the country but in Israel as well. Well, according to a weekly bulletin by the Indian SARS-CoV-2 Genomic Consortium, which is basically a consortium of several labs which are doing this sequencing across the world, really, they have said that the Delta variant continues to affect people around the world, with Israel seeing new cases rising in the near previous highs, despite, and that's important, about 60% of their population being fully vaccinated. This consortium of 28 national laboratories set up in December of 2020 to monitor the genome variations of SARS-CoV-2 that causes, that's COVID-19 basically, and the various frequencies, the sequences that are coming out of it as well. The Pan-India network, it functions under the Union Health Ministry. In fact, previously it had described this new sublineage that we are talking about of the Delta as AY.4. However, after reevaluation of the mutations that define this variant, it has been classified, given a new name. But what exactly is this? Now, fundamentally, the viral evolution works like any other kind. As viruses spread through the body, it makes copies of itself, which often have small mistakes and changes. As such, the Delta variant, the full form of which was, remember, B1.617.2, that had given birth to several other variants as well. We had discussed Delta Plus variant in an earlier episode of FYI as well, that bear most of its characteristic mutations but are different in other ways. One of these is the one that we are talking about right now. It is a dominant lineage, is what the experts are saying. Even in Israel, they're talking about it, and one that is reclassified as a Delta sublineage. However, its rapid growth in Israel alone means that it should be examined further. This is what that consortium is talking about. In fact, they took out several other variants of that within the Delta variant to try and see, is this any different? Is this going to be the next thing or next variant that will cause that much talked about third wave in the country? However, at this time, none of these sublineages, important to note, have been found to have any growth advantage over the Delta patent, as it were. But how is this different from Delta? Well, according again to the same consortium, it is not known yet whether Y.12 is clinically different from the Delta variant, but further the consortium said that functional impact of the changes between Delta and Y.12 is not known, but the two appear very similar in their molecular level. And however, it has lost some of the mutation since the Delta lineage, and the spike protein there are some minor changes over there. However, the rapid growth in Israel means that it should be examined further. At present, the most dominant strain in Israel is this FYI.112. 51% of the samples studied there have shown the prevalence of this variant based on the number of sequences that have so far been uploaded on the research groups there. The prevalence of this variant over the last week also increased to over 20%. In fact, outbreak.org, which tracks these new variants and their prevalence based on the data uploaded on these websites, estimate that since the beginning of the pandemic, 1,504 samples of FYI.12 have been uploaded from India alone, which is 4% of the total variant samples that India is collecting at this point. The first sample in India dates back to the 7th of September 2020. So much talk has been done about this variant, about several other emerging as well. There's another C variant which is now being talked about, said to be much more sort of infectious than Delta. But we look into all those details with our experts today and also try and understand from them. So what should you and I really be doing at this point? Like I said, the festival season is coming in. We're all very, very impatient to step out and sort of get back to normal life. But why should you be careful? For this discussion, we've got with us Dr. Narayan. He's the Director for Global Health Alliance in UK, cardiologist there at St. George's Trust, London. Thank you so much for your time, Doc. We've got with us, back with us on FYI, Dr. Arvind Soin and Arvinder Soin, beg your pardon, sorry. And we've got with us Dr. Anish as well from Kerala. We'll try to understand from him some of these breakthrough cases, why is that happening. Also, Kerala has such a good record of vaccination as well. So why exactly are these cases coming in? And also Dr. Tripti is back with us on FYI to give us her insight on all of this as well. Let me begin by giving the first word to Dr. Anish at this point. Dr. Anish, I just pointed out one of the many variants being discussed at this point. Any link can you first give us about what's happening in Kerala versus these new variants, and say what's happening in Israel as well?
Actually, Kerala is a good case study if you look at various Indian states, because Kerala is a state which has got very low levels of natural infection, as it is evidenced by ICMR seroprevalence study, and the vaccination levels are very high. It is the location or the state which has got lowest natural infection proportion and almost the highest of the vaccination proportion. In that case, Kerala may be used as a case study. And it is nothing amazing or nothing strange that Kerala is reporting more breakthrough infections, because vaccines are made up of strains that were available by maybe February or January of 2020. So we are using vaccinate strains to fight against the Delta strain. So Delta is notorious for making breakthrough infection. It has got an immune escape phenomenon. So it is natural to see more breakthrough infections in Kerala. And another thing is Kerala's health system is capable enough to pick up breakthrough infections, because most of the breakthrough infections may be mild and some of them will be asymptomatic. And Kerala is able to pick up. That may be the reason that we are seeing almost 3% of our total infection is total breakthroughs. That means at least 2 vaccines were taken.
Right.
So in Kerala,
can I interject
25%
there,
of
Doctor,
our
to
population.
just, because I have a follow-up question to what you're saying. So A, if I understand you correctly, you're saying because not many people got it there, so there is a larger population that is open to infection. That's one point that you're making. And the other answer that I'm seeking at this point is, has there been any one underlying variant that has been spotted in these fresh infections that are coming in?
No, actually, we have got the genetic analysis available for July 2021. The August data is on process, and we are reporting lowest number of other lineages, maybe sub-lineages of Delta among Indian states. My point is, if just any sub-lineage, is very similar to a Delta variant in creating breakthroughs, there is nothing to worry. But if this particular variant is going to create breakthrough among people who has got the Delta infection already, then there is something to worry. So, other than Kerala, the other part of of India where the actual natural infection because of Delta was very rampant, if you are reporting some kind of breakthrough in among naturally infected people, and even infected by Delta, if there is a breakthrough, then that will be a real concern. But Kerala,
very
we are
important
not
distinctions. Right. Sorry, please complete your point, sir.
In Kerala, because we are using a vaccine strain, and almost all breakthroughs are because of the Delta itself. Any of its sublineages, but B1617.2 itself, 100% Delta is spreading in breakthrough as well as in natural infection.
I see. Very important points over there. Let me go to Dr. Ryan next on this point. Dr. Ryan, could you just break it down for our viewers as well? How are these variants different from their sublineage? And how soon or what characteristics really point us towards whether or not this variant is going to be a cause of concern? Like I said, in Israel, the same variant also found in good quantities here in the country, almost 2,000 there of the statistics known so far of the samples connected. But we are not looking at it with as much of interest as, say, Israel, which has already given its booster doses now based on this data.
Thank you, Sonal, for having me on the show. As you know that in UK, in about March, April time, we had about 2,000 to 3,000 positive cases. But now we have got about 30 to 40,000 positive cases. Delta variant kind of started in the UK and obviously it spread like wildfire. Till date, we are still having about 30 to 40,000 positive cases in the UK. So again, going back to your question, I think it is very important that we should further read into this AY.2 variant that we are seeing, especially in Israel and some parts of India. It is still very early to say whether it is sublineage of Delta variant or it's a new variant of COVID on its own, which may be more infective, because again, these are all very early times. We have to have more genomics, more details to understand what exactly and how infective it is. But most important, I think the message that should go to the public is that most of the vaccines that we have got, the Pfizer, the AstraZeneca, all the studies which are coming out are showing that they're 92, 94, 96% effective in preventing. Even if you get the virus after getting infection, I mean, look at UK. Out of 30,000, 40,000 positive cases, there are only a few hundred people who are requiring hospitalization. Number of deaths are less than 20, 30 and 40. So it is 10 times less than what we had in the previous wave.
Right, and Doctor, the thing is that that's not the same case in US, for example. We've been getting some very troubling reports from the United States where the number of people in hospitals is actually at an all-time peak.
Absolutely. But you have to look at the numbers of people who are getting to the hospital. Most of them are unvaccinated. They have not been vaccinated. So majority of the deaths, majority of the hospitalization, whether it be Europe, America or US, are happening in people who have not been vaccinated. So I think the most important message that is there, that we have to get vaccinated as soon as possible. And in fact, the time has now come to think about the booster doses, because again, UK, we are discussing about giving the booster because we know majority of these studies have shown that if immunity goes down by 6 months, 9 months, you don't have any antibodies left. So I think the time has now come to start thinking about booster for most of us.
All right. Has the time come for India to start thinking about booster doses as well, Dr. Soin?
Well, ideally, yes. But the problem is that we haven't actually given the first shot to more than 50%, and only about 12% or 11% of the people are fully vaccinated with 2 doses. So in terms of equity, I think that it's better that people get at least 1 or 2 doses, ideally 2 doses, before we start giving booster shots. Now, obviously, the booster shots are needed for people who had vaccination early, people who are highly vulnerable because they have comorbidity or are elderly, because these are the people who are actually vaccinated and getting hospitalized and dying in the US and UK. You know, the early vaxxers and the elderly people. So those are the groups that need a booster shot, if at all. But in India, we can't really think of it.
And healthcare workers as well. In India, they were the first lot to actually get vaccinated.
Yes, the healthcare workers, because we were the first ones to get the first and second shots of our vaccine. But these things can't happen unless maybe another 2 months, for another 2 months, until we give the first shot to at least 60% plus, and ideally fully vaccinate at least 40 or 50% of our population. So that's the concern.
Right. So I'm just going to pause here for a break, but I have a very interesting viewer question that just popped up on my timeline. This is gentleman who doesn't want to be named, but says that for how long will this really go on? Because variants will not stop. So how long do we continue to be inside our homes? It's a very valid question, what everybody is thinking, and I'll have Dr. Trupti answer that, who's waiting very patiently with us on the panel on the other side of this very quick break. Welcome back. It's the festive season. It's also the season where a lot of new variants of COVID are being discussed. We told you about one before going to the break, but let's also bring out this one for you. C1.2, said to be more infectious and evade vaccine protection as well, according to certain studies. This is a variant that has been detected in South Africa, many other countries as well. And at this point, people saying this could be more transmissible and might be evading vaccine immunity as well. Let's go across to Dr. Trupti now. Dr. Trupti, your thoughts on these new variants that are coming in, and also the question that I popped in earlier. We keep talking about these new variants. At the end of the day, people are wondering, this is not going to stop, right? So what is going to be our exit to this COVID?
So by now we all agree that COVID is eventually going to become endemic, and by endemic we know that it's going to stay with us like all other viruses, like influenza. But until it becomes endemic, until we understand what's happening with newer variants and the effect of the vaccines on these variants, there are two things that will have to be followed, which will be part of our new normal, which already are, is masking and avoiding large gatherings. So these two things are not going to go anywhere soon. These are things that we will have to live with. And talking about the cases despite vaccination, I think it's time that we need to change the yardstick. We only keep talking about how many new cases are we seeing or how many breakthrough infections are we seeing. But we know that vaccines are not 100% effective in preventing infections. They are actually effective in protecting from hospitalization and death. So while we talk about number of cases, I think what we really need to start talking about is what is the case fatality rate? What are the number of deaths that we are seeing? And in those terms, you will see that Kerala is doing beautifully. They vaccinated their population. Their hospitals are not overburdened. The case fatality rate remains low. And that was the entire goal of vaccination, is cause a flattening of the curve to a state where you see numbers, but you're able to manage those number of cases.
Right. So what is your recommendation then, Dr. Trupti, to people who are stepping into the holiday season and the festival season right now? Everybody is itching to go to each other's houses, meet them as well. Are you saying that when you say avoid big gatherings, does that mean you can still meet people in the bubble with the rise of these variants, meet vaccinated people? What should one be doing?
One thing that we've learned is that how much ever we tell people don't meet each other, they're still going to meet each other. So we have to give them realistic to-do points. And what is realistic is definitely avoiding large gatherings. So yes, meet your relatives, meet your friends. But what's important is whenever you meet them, make sure you're in a well-ventilated room. Make sure you're all masked. And I think that is where we falter. We are masked outside. But as soon as we get in with our friends or relatives, the masks come down and we are in closed rooms. So as long as we can ensure well-ventilated rooms, we can ensure good masking, I think that is the step forward, given that there might be new variants coming down in future.
All right. So ensure that you're vaccinated. That's number one. Ensure that if you're going out after your vaccination and if you have comorbidities, especially be careful around those people. Then ensure that if you are meeting people, have your mask on and keep your room highly ventilated. Those are good tips coming in there from our panel. Thank you all so much for your time. We'll keep tracking these variants as we move forward in our COVID journey as well, to try and understand which are the areas which are emerging as hotspots as well, and when do you really need to start getting even more careful. That's it from us. Bye for now.